So I think we'll get things started. My name is Rachel Gage. Hello and welcome. We're really glad you're all here with us. I am here with the Kenosha County Care Transitions Coalition, and I'd like to welcome that committee as well as our committee panelists. We have a video proclamation from County Executive Jim Cruiser that we would like to start with.
Whereas National Healthcare Decisions Day is April 16th, 2022, and is being observed with a local event on April 8th, 2022. And whereas this day is intended to raise public awareness of the need to plan ahead for decisions related to end-of-life care and medical decision-making wherever patients are unable to speak for themselves, and to encourage the use of advanced directives to communicate these important healthcare decisions. And whereas it is estimated that only about 30% of the population have executed an advance directive, in part due to the lack of knowledge about them and considerable public confusion arising from directives that are often written in difficult to understand legal and medical terms. And whereas one of the principal goals of Healthcare Decisions Day is to encourage hospitals, nursing homes, assisted living facilities, continuing care retirement communities, and hospices to participate in an effort to provide clear and consistent information and increase the number of residents with advanced directives. And whereas, as a result of April 8th, 2022 being observed as Healthcare Decisions Day throughout Kenosha County, more citizens will have conversations about their healthcare decisions. More citizens will execute advanced directives to make their wishes known, and fewer families and healthcare providers will have to struggle with making difficult healthcare decisions in the absence of the guidance from the patient. Now, therefore, I, Jim Cruiser, Kenosha County Executive of Kenosha County, do hereby proclaim April 8th, 2022 as Kenosha County Healthcare Decisions Day, and encourage our citizens to plan ahead for healthcare decisions related to end-of-life care and medical decision-making, and execute advanced directives to make their wishes known. Given under my hand, April 8th, 2022, I'm Jim Cruiser, Kenosha County Executive, and you make it a great day. Hi, I'm Jim Cruiser, Kenosha County Executive, and I'm proud to be here today to give a proclamation for Kenosha County on Healthcare Decisions Day, April 8th.
And I'd like to introduce Helen, so she's able to introduce our next video.
Good morning, everyone. First of all, thank you for hanging with the foibles of technology with us. Secondly, I am Helen Sampson from the Aging and Disability Resource Center of Kenosha County. And on behalf of the Kenosha County Care Transitions Coalition and the Advanced Directive Work Group, I want to welcome you. We are about to share a short video that the work group put together. And our group is made up of some really wonderful folks in the community. Rita Hagan is our chair from Hospice Alliance, Barb Beardsley from Brookside Care Center, Jamie Laurent from Frederick South, Rachel, who you've already met from Advocate Aurora, and I'm about to introduce you to Brian Binsdorp from Kenosha County. So let's play our video and learn some more.
Welcome to It's About You, Understanding Advanced Healthcare Directives. My name is Brian Binsdorp. I work for Kenosha County Human Services and am a member of the Advanced Care Planning Work Group. Today, I'm bringing along some friends and colleagues to be your guide in understanding healthcare directives and why they matter to you. I'd like to start by introducing you to Amy.
What was it that brought you to say, yeah, let's get this done?
So it really started when I was 19. I worked in a hospital in Kenosha for 4 years and would be all over the hospital doing different things. I worked in the pharmacy, so I was kind of out and about in different patient rooms and things like that. And so It really opened my eyes. I think as someone who's young, I think that I always find myself feeling invincible and that I'm always gonna be here forever. But I think working in the hospital setting really taught me that anyone at any age can be put in there, and making sure that all the right paperwork and processes are put in place so that it's a smooth transition regardless of what happens in my life for family, friends, and all of that.
Life is uncertain. The information scrolling on the screen shows the top causes of death from the CDC for people aged 20 to 24. It is important to plan ahead for future healthcare decisions, and if you are unable to make your own decisions, others would need to make them for you. The next question is, how is that accomplished? It is accomplished through an advance directive, which is a written legal document. At minimum, a power of attorney for healthcare is strongly encouraged for anyone over 18. This easy-to-complete document is free and authorizes another person to make healthcare decisions for you if you are unable to do so. Let's hear more from Judge Meyer.
I was a practicing attorney for 25 years before becoming a judge, and I would be the one preaching to everyone to get this done because of all the benefits that are associated with it. And I never did mine for quite a few years. You know, I was in my 20s and 30s and I didn't need one. At least that's what you think. Or I'll do it tomorrow, that type of thing. And then eventually it's like, yeah, no, I need to practice what I preach and do mine because it's extremely important. So what really probably motivated me the most, aside of the fact that I knew that I needed to have it done, is the peace of mind in getting it done. Having it in place, having the control of designating who I wanted to make certain decisions for me in the event that I wasn't able to do so was extremely important to me, because what I do know, again, from practicing as an attorney and even being as a judge, is that you don't always know what a court will rule. And I would have rather had the control over decisions regarding me versus a court or anyone else. So that was the biggest factor.
There are many good reasons to complete an advance directive. The most surprising and misunderstood of these is that Wisconsin is not a next of kin or family consent state. That means as soon as you become an adult at 18, no one can automatically make decisions for you. For example, parents or significant others are not guaranteed the ability to speak on your behalf should you need it. Dorothea shares her perspective on the value of this process.
I think what I learned most about myself is something that is shocking to me, even as we discuss it now, is that in preparing the document, it's not just about looking at death. It's also looking at the life you currently live. Mm-hmm. And that was a very hard thing for me, because I realized that my fear was not in the conversation or death itself, it was in living. And have I been selfish enough right now, today? And it has made me make some really interesting life choices as a result of that, doing things that were more about me and for me, because I don't want to only have quality of life in death. I want to have quality of life in my life as I live. So the conversation is far deeper reaching than that of my last wishes. At least that's how I took it. And it guided me to make some profound decisions in my personal life as it relates to quality of life.
Just to review, who needs it? Every adult. When do you need it? Now. So let's get started. Who would you want to speak for you? The healthcare agent you choose must be willing and able to make the choices you would make yourself. This requires you to think about your values and goals and communicate them with your agent. This will ensure that your provider and others will follow your wishes and respect what is important to you. Let's get a little more specific about these steps. When choosing your agent, consider a person who can make difficult decisions in emotional situations or under pressure. Also consider someone who understands what you want and will honor that, even if it is different from what they would want for themselves. Let's hear from Amy about her choice.
You did great by making sure that your brother is willing.
He also is someone who, so he's currently in pharmacy school, so he has a good healthcare background. My mom works in healthcare, so that also assists. I also have two brothers, but chose one of them over the other because the other does not do well with very tragic medical incidents and the pressure that is associated with those. And putting that pressure on him, I did not think would be fair to either of us. So choosing one brother over the other, there was kind of some thought behind which one would be chosen.
Defining your values and goals is not always clear or easy, and everyone is different. One frame that can be helpful to consider is what brings your life meaning and value. Whether you're a patient or a physician, these are the questions we all must consider.
I think that the document itself is not just enough. It's really what you're asking about it, what goes behind the things that you're saying, and are there conversations that are happening? Mm-hmm. What motivates you to stay alive, basically? And for me, I would hate being a burden on other people. I don't want people to have to take care of me all the time. And if it got to a point where I wasn't able to be independent anymore, that's when my family knows that I would want to start having limits set on how aggressive to intervene.
Having conversations with people you trust, such as faith leaders, teachers, friends, or family members, may help clarify your preferences regarding life-sustaining treatment and other medical interventions. Starting the conversation with your agents is a critical part of the process. If an agent is uninformed, the burden for them to assume this role, if ever needed, would be great. It is also important to keep the conversation going as life experiences and your thinking evolves. Representative Tip McGuire brings this point home.
Few things, first of all, in regard to the process. In many ways, the process is kind of the point, right? Is that you have these conversations and it makes people feel more comfortable, and it also normalizes these conversations with your loved ones. You know, I have to say it's kind of refreshing to be able to talk about these things openly, because I think when we think about these things, they're typically things that we keep to ourselves or consider internally, but it's much more comfortable to talk about it with your loved ones so that they understand your perspective and you understand theirs. And it really does make it easier to talk about these things moving forward. So I just want to emphasize kind of how wonderful the process is once you get past that initial hesitancy.
You've done good work so far, so it's time for a humor break, because I know how it will end for me. One of my friends will unplug my life support to charge their phone. Even old rockers can find some humor in this process.
And just to end up on a piece of humor, like you said, if ever you come into my hospital room and I'm on life support,
Yes.
unplug me and wait for a moment and then plug it back in and see if I reboot.
Okay, back to work. The document needs to be completed if any of this is going to matter. Remember, it's about you, what's right for you, and taking responsibility for your future. You are in control. It begins with taking ownership of the document with your name, address, and date of birth, and appointing your primary agent and optional secondary agent. The secondary agent comes into play only if the primary agent is unable or unwilling to serve. This page gives permission to your agent to admit you into different long-term care settings should it be required for your care. It's important to remember this question is not necessarily about what you want, but rather what level of care you may need and what authority you want your agent to have. If you are confident about your agent's ability to serve you well, think carefully before you limit their ability to support you. Checking no prevents your agent from making any decision. The same principle applies to feeding tube and pregnancy care. If you are confident about your agent's ability to serve you well, think carefully before you limit their ability to support you. Remember, checking no prevents your agent from making any decision. That's it. There are no more decisions to be made. If you are missing something that is important to you, the blank area in the Statement of Desires section is your opportunity to personalize the document should you choose. For example, you could talk about pain management, comfort preferences, family dynamics, religious practices, or even something humorous or personal, such as make sure my nails are painted or turn on the game. Let's see how Amy made this section her own.
So I'm including, please consider quality of life post-hospitalization.
Nice.
When making decisions, because I think that that's always just a good reminder to have on here, since that's like one of my main concerns of any long-term changes to my health. And then also I'm very much someone who believes those who are on like a ventilator or not necessarily conscious with the things like the situations around them, highly believe that people can still hear and sense different things that are happening. So also just ensuring that there's visitors and conversations happening and updates happening to me, even if I'm not mentally cognizant of different things.
Now you sign and date the document in front of two witnesses. Be sure to carefully read on the document what makes a witness valid. Keep in mind that all the dates must match. This last optional page allows for the agents to acknowledge they are aware of the responsibility they are assuming, as well as reinforcing any organ donation wishes. Even though the document is now valid, it remains dormant until such time as two physicians or a physician and a physician's assistant or nurse practitioner activate the document by affirming you, the principal, does not have the capacity to make healthcare decisions. Only then can your agent step in to make decisions on your behalf. We have provided some useful links if you would like more information about advanced directives. Thank you for spending time today learning about advanced directives. They are important for you and the people who love you. I welcome you to connect with any of the local resources listed if you would like assistance in completing or witnessing your document.
Thank you. And now I'd like to turn it over to our panel.
So I'm going to invite our panel to unmute and turn their cameras on. Hello, everyone.
Good morning.
Good morning.
And it's sad to say, but we cannot get Todd's camera on, and we don't know why. He's a very handsome gentleman, so this is going to be a lack in our panel. But he carries his voice well. And Steve, are you having trouble with your camera too?
It appears it's not working now. I think you had to give me permissions last time to make it work.
Yeah, well, maybe Katie can try to mess with that behind the scenes. And in the meantime, I'm going to, I think I'll go alphabetically so I don't have to do that. Oh, there you are, Steve. Welcome back. We'll go alphabetically and have you guys introduce yourselves, because then I don't have to mess with the age before beauty controversy. Amy, can you go first, please?
Absolutely. So I'm Amy BALTES. I'm 25 years old, born and raised in Kenosha, went to undergrad at UW Parkside, and then moved to Madison about 4 years ago for grad school. And now I work in addiction medicine research here at UW, and I'll be starting medical school in the fall.
Thanks. So glad to have you. And Veronica.
Hi, I'm Veronica Chapetti. I am 24 years old. I went to Gateway for Human Services for my associate's degree. Then I went to Parkside for my sociology to get my bachelor's degree. I worked for the Aging and Disability Resource Center. I am a long-term care specialist.
Great. We're so glad you're here. And Todd.
Well, good morning, everybody. I'm State Representative Todd Onstead from the 65th Assembly District, and it's great to be here. I think I would be remiss today. We started out the program with a video of Jim Cruiser, and I would just like to thank him, take the opportunity to thank him for his decades of service to Kenosha and Wisconsin, and what a great leader he's been in Kenosha County. I'd also like to thank the Transitions Coalition. This is great, important work, and look forward to the panel today.
Thanks so much. And a special introduction to Joe, who really did the hard work of pulling that video that you just saw together. So, Joe.
Well, shucks, it was my pleasure to do that. I'm Joe Potente. I'm the communications manager for Kenosha County, coming to you live from the county administration building downtown. I am 41 years old. I'm a Kenosha native. I left here for a while to go to school out at UW-Madison, met my wife out there, dragged her back here where I worked for the Kenosha News for quite a few years before I joined the county about 5 years ago. And we have twins who are 8 years old who attend Southport Elementary School, my alma mater.
Oh my gosh, full circle.
That's full circle.
Yeah, wow. So glad you're here, Joe. And bringing up the end of the alphabet, Steve.
Hi, Steve Winter. I'm 40 years old. I also have a Parkside graduate with criminal justice. I've been employed here at the City Kenosha Police Department for approximately 15 years. That's about it.
Well, we're so glad that you are joining us today. You know, I'm tempted to take a second and tell a story about having my daughter in her doctor's office, and she had just turned 18, and the medical tech asked her if she had a power of attorney for healthcare. And I thought, oh my gosh, no, and you totally need to do that. When we spoke to her doctor at the end of the visit, I said, you're going to be so proud that Emily is going to do her power of attorney for healthcare. And that physician, understandably and with all good intentions, said, yo, honey, you don't need to do that till you're 65. So I really love that this panel especially is so heavily stocked with our younger generation, because the advanced directive need is for everyone over the age of 18. And I'm just really excited that you're all here and we can dig into our conversation. So, congratulations. Some of you did your power of attorney for healthcare recently, and some of you had done it a while ago, and we did ask you to pull it out and look at it. So I guess my first question, removing the Helen is a fabulous nag from the motivation, what made you want to do this? Who'd like to start?
I'll start, because I was going to say Helen nagged me to do it, but I got more to the answer than that.
Oh, good.
My first experience, probably the first time I came to understand what a power of attorney for healthcare is, was probably about 15 years ago, when my mother, who is healthy and to this day, was going in for some surgery. And at that time, she was urged by her doctor to do that, just in case something went awry, which thankfully it didn't. But I signed on to that as her agent way back then. And in the back of my mind thought, this is probably something I should do too. But it was one of those things that you know is important, but it never seems urgent. And about 15 years went by, including some years in which I helped to promote this program, and I still thought to myself, I should probably do that. And finally, Helen as a nag came in this year, and I did it, and it was so easy to do. So I encourage everybody not to wait 15 years after you first think about it.
Who else?
Well, I'll go ahead and start. I think that I filled my first one out about 25 years ago. And one thing, when I pulled mine out and took a look at it for this program, I realized that some things had changed. Actually, it was when I was looking at my wife's. We both realized that her secondary was her mother, who has been deceased for over a year. So I would encourage people to not only to fill it out, but also to make sure to review it. perhaps on an annual basis, maybe when you change the batteries in your smoke detectors. I'm not sure about maybe on January 1st, but I would review it because things do change, and also maybe some of the decisions that you wanted to make or have made for you years ago, maybe those have changed over the years.
Thank you, Todd, for bringing that up, because that's really a secondary and important piece. We talk about the 5 Ds when it comes to revisiting your power of attorney. Divorce, because in the state of Wisconsin, if your spouse is your agent, once you divorce, or if you divorce, even if you like each other and want to keep them as your agent, the document becomes null and void. Death, as you so eloquently spoke to, that is part of what can change in who your agents are. If you've had a recent diagnosis, and I can't remember the 4th one, but the last one is every decade. So every year, nice, but definitely every decade. How about you, Amy?
Yeah, so I think my biggest thing I've seen in the video before is I worked in healthcare for a number of years, and seeing people who are my age or younger come in after they were 18 but not having this document in place was kind of my driving factor for getting it in. I think I've been talking to you since I was pretty much right out of the bat at 18 about getting this document done, but hadn't completed it until earlier this year. And just to echo Joe's point, very quick to complete, very easy to complete. So looking back, I should have done it sooner, but I am glad that I have it done.
Thanks so much. Steve, how about you?
Well, I completed mine about 10 years ago, and I was very fortunate that our police department, and the reason I got an advance directive in the first place was because of the dangers of my profession. They had a local attorney office came in and volunteered time to do what's called Wills for Heroes. So not only was it important that we got it done, they assisted us with it and made the process very simple.
Excellent. Wills for Heroes. That's a cool program.
Yes, it was very nice.
Yeah. All right. Great. Thank you. Veronica?
So I've always thought of getting it and I just never did. Helen did push me a little bit to go get it, but it was super easy and fast, and I'm glad she did because I definitely should have got it sooner. I got it like a few weeks ago,
So I do want to say that I cannot nag the entire county. So I'm going to need some help here, folks. By being on our panel and our past panel members, you are all now ambassadors and must continue in the nagging tradition. Okay, just making it clear. Also, one of my team members put in chat that the one I couldn't remember of the 5 Ds is decline. So if someone's in a health decline, that's another time to pull out your power of attorney and check it. So part of what we talk about in our work group, and those of us who are very invested in becoming lacrosse, is what we say, because in lacrosse, 97% of the people who die in a hospital have completed a healthcare power of attorney. 97%, compared to what you heard in the video is 30%. So we are climbing our way to having a community that embraces this opportunity to have those documents in place, and more so, have those meaningful conversations around the documents and what they can mean in our relationships. So I'm interested in what kinds of conversations you've all been having as you've completed this document and have had opportunities to reach out to folks in your life.
I can go first with this one. I think it's a little unique situation with myself, my mom being a nurse and my brother working in healthcare as well. So our dinner conversations are not the average conversations that the normal household has. So I think the conversations surrounding what we all wanted in terms of our power of attorney came a little easier, but they were still enlightening because a lot of the values that we shared were not something that just are a part of everyday conversations that we have. And so setting aside time to make sure that not only my two signers were aware of what I wanted, but also other individuals in my life who may be a part of those situations, whether they're direct people that would make those decisions or not, was important to kind of share and have the broader topics. So
yeah, awesome. And yeah, I would say you're not a normal dinner table conversationalist.
Not at all.
And I say that with love and affection, you know that.
Of course.
You know, I do think that, well, let's be honest, right? This movement came out of troublesome endings for people. And there were enough of them, right? So it's not only important to have that agent be prepared, but it is important to try to get everybody on the same page, because you don't want Uncle Fred coming in at the last minute and causing disruption. So if Uncle Fred's part of your system, even if he's not your agent, have a conversation with him. This is what I want. So there shouldn't be any questions. How about you, Todd? What are some of those conversations you've had around this is what I want, and with whom?
Well, those conversations date back probably around 30 years ago, actually, when I made my first one with my first wife. And, you know, we both made ours out together after you know, several conversations in terms of what we would want in the event that one of us had serious accident or a debilitating disease. And we later divorced, and so that became invalid. And so of course I filled out a new one later with my second wife, and I'm actually on good enough terms with my first wife that she is my secondary. So you know we've had those conversations, and actually we were both in agreement in terms of donating organs, and also in terms of how much care that we would want to have in the event of a serious disease. So these are just kind of important conversations, and I guess as I get a little older, kind of easier to have, and recognize that none of us get out of here alive, and it's just something one of those things that we have to do.
Yeah, I definitely agree. Age brings the conversation closer. And I have to say, I'm so impressed with Amy and Veronica, and even Joe and Steve can be considered young, comparatively speaking, to taking this on at this point in their lives, because, we've learned some things through COVID. There are some great equalizers in terms of anything can happen at any time. Nobody gets out of here alive, right? And as an old hospice social worker, I will tell you, those are the conversations that create real connection and real relationship, where we can be vulnerable and share our fears and share our doubts and share our wishes. That is an important part of the human experience. So anybody else want to talk about their conversations?
I thought,
go ahead, Joe.
Oh, I was just going to say briefly that I thought it was interesting as I started to talk with my wife about this, that it's possible we have different opinions about some of these things. I would, just assume that we would want the same things, and that's not always a safe assumption. And certainly, as her agent and vice versa, I think we're both happy to support what each other wants, but those things might not always look exactly the same.
Yep. And that's what it is. This is about my wishes, right? And, you know, our bodies are ours, so we get to make those decisions for ourselves. And you're right, we're all a little different. Some of us are a lot different, but definitely a little different. Steve, what was on your mind?
Well, I was going to add that based on my profession, I deal a lot with death and medical calls, work hand in hand with the fire department, and a lot of the people that I speak with that are close to death, that the conversation will come up. But the biggest thing, to hit on what Ms. Sampson talked about, was the civil aspect of it, is how many fights I've seen between families when someone goes and nothing is set in place for the other person. And now you've got 5 people arguing over something that should be, you know, already arranged, and it would eliminate a lot of problems.
Yeah, that's another really good reminder. And even if it doesn't escalate to, you know, a legal issue, it can be painful for a family that doesn't know. And that's certainly part of what brought me into this work is my dad had a cardiac event that resulted in a coma, and he had never had any conversations with anyone, including my mom, about what he would want. And so between 5 kids and 2 in-laws, we all brought our baggage to that conversation, and it got uncomfortable at times. I mean, we worked it out and we got there, and we got some help to get there too. But man, it would have been a lot easier had we known. Veronica, any thoughts from you on the subject of conversations?
Yeah, so my dad's actually a cop, and then my mom's a nurse. So I'm both very open with both my parents because, like Steve said, my dad's seen the worst, seen death, and deals with it every day. So we've always been very open to each other, what we want, what I would want, and he's been very respectful of it, even if he doesn't agree with everything that I want. So
awesome. It's that openness that I think really helps, huh? Mm-hmm. So when we're talking with our agents, one of the things that we tell people is there's some basic decisions, right? There's CPR and how you feel about that and under what circumstances. The use of a ventilator is a bigger conversation now, especially with COVID. Artificial nutrition and hydration and comfort care. Those are some of the core things that we should be clarifying our desires around. And as Todd said earlier, those can change as we age and are in different places. But past that, I really believe the most important thing we can do is talk with our agents about what it is we value. So I always give the example of, you know, one of my values is I'm a little cheap. I'm just going to put it out there. Some people would call it frugal, but I'm okay with cheap. And so my husband knows that there will be no unnecessary tests and wasting of resources, that would be cause for me to come back and haunt him. So what are those value things that came up for you in your conversation around what helping your agent understand what your wishes are? Does anybody have an example of those kinds of things?
So I can say for mine, one of my biggest things was quality of life following any type of hospitalization or major event that would occur with my health. And so when I was talking to my brother about it, it wasn't so much as here is my set list of tests and surgeries that I'm okay with, and here's a set list of what I'm not okay with. It was more so, this is the quality of life that I want to lead after any of these events. And if I'm able to get that through whatever surgery that would be, then that's okay. But if I'm not able to reach that, then that should kind of be more of the determining factor versus a hard yes or no to specific components of care.
Great. You feel like he understood what that quality of life means to you because you gave him really specific examples. Yeah.
Exactly. Yeah. And I will say it led to kind of a further discussion about particularly how this relates to incidents where they don't result in death, but more so just potentially major life changes. And so it was a good conversation that kind of sparked some discussion and kind of learned about what we considered quality of life and how that differed between him and I. So
yeah, awesome.
Well,
Anybody
I agree
else?
with Amy in terms of quality of life. Certainly that's probably paramount in my decision making, but also, the last thing I want to do is on my way out is to be a burden on my friends and family and the ones that I've decided to make my agents, and I don't want to leave them guessing in terms of what I would have wanted. I want to make sure that it's clear, and last thing I would want to do is end my life being a burden to my loved ones.
Thanks, Todd. That's also really a big driver for many people. Yeah. Anybody else thoughts about what are your values and how they impact your power of attorney for healthcare and your wishes?
I was going to add to what Amy had said, and what's really important when picking your agent is obviously someone that knows you. You can't check every box. You can't plan for everything. Weird stuff happens. So by picking an agent that knows you, and my wife knows me better than anybody, makes that decision much easier for them.
Yeah. And, I think often people who are married will pick their spouses because there is that level of intimacy and knowledge. And I also tell people it's kind of a job application, picking your agent. And for some spouses, even though they know the person well, they may not feel comfortable in that position, or they may not feel comfortable being an advocate in a healthcare setting because it's no day at the beach necessarily, right? You may have to do some real assertive advocacy. So, that's where you can also get creative, where you may pick someone who's got that skill set as your agent, but then put in your statement of desires, make sure that you confer with my spouse, those kinds of things. So
that's interesting, Helen, and I think we talked about this when we met in terms of my secondary and my wife's secondary. We sort of had to think about where we would go with that. And our parents are at an age where it didn't make sense to us to put them in because, this may not come up for a decade or two, and they may not be in the position then to do that. I happen to be an only child, so I didn't have the brother option like Amy. My wife's brother is married to someone who works in healthcare, and she's a very thoughtful person, and she came to both of our minds as someone who we trust. So we ended up going with, an in-law through marriage. And we were confident in that decision.
Excellent. What surprised you all about going through this process?
I would say it was a lot easier than I thought it was going to be, but again, I had help. So that surprised me. I really thought it was going to be a daunting task, and I really wasn't.
That comes up for a lot of people we talk to, Steve, and we encourage help. At the end of the presentation, you're going to see a slide where you can get help to complete your power of attorney for healthcare. And then I do think it's really easy. It's not a terribly complicated document, so it can be done without help. But yeah, that's what we hear a lot is this wasn't as painful as I thought it was going to be, or it was a lot easier. Anybody else have any surprises?
I think knowing that it's a document that probably will change over time is something I wouldn't have thought of. And this idea of revisiting it every year or every decade, and knowing that your wishes might change, our agents might change, all of those things surprised me a little bit.
I know I always have this fantasy that I'm only going to have to go to the grocery store one more time. But it never works that way. I got to go back. I got to replenish. I got to take inventory again, you know? So yes, this is a living document and it will change over time. One of the things I'm really curious about is now that you've all accomplished this important task, have you talked to other people about completing their power of attorney for healthcare? And if so, I hope you start, if not. But if so, what has been, have you found any tricks is what I'm looking for. Have you found a good way to frame this for the other people in your life? Have you had any success in, nagging with love?
I will say as soon as we finished doing my document, I went to quite a few friends and I was like, guys, this is the easiest thing you'll ever do. It's good to do it now. I pretty much felt like a salesperson for the POA for about a month after we did it, because everyone that I ran into over dinner, things like that, I'd be like, I have a topic to talk to you about and you'll never believe how easy it is to do. And so just echoing Steve's point and kind of everyone else here is, I think the biggest thing is just highlighting the ease of it and how important it is, and making sure that people have those conversations, even if they're not the easiest thing, but kind of gives a peace of mind once you have it filled out.
Do you know if anybody's done it?
I have two friends who have completed it and they're both in their 20s, so.
Excellent. I do want to point out in the chat that Barb has put the link in that takes you to the online Wisconsin form, so you can actually fill it out electronically, which is a nice resource. Who else has had some success talking to other people?
I've talked to some of my friends, albeit they're older than middle age, and those who hadn't done it realized that they had to add it to their to-do list. And one of the things, other than just the ease of doing it, that I found is, it's just the satisfaction that you get from checking something off of a to-do list, and it's a kind of a major thing as you age, but I think that it's certainly a good idea that Amy brings up, that maybe I should have that conversation with some of my younger friends as well.
And or adult children.
Correct.
So one of the things that comes up for me is completing the document is not completing the process. Because you can have the document done, and if it sits in a closet and you never make copies or give it to anyone and no one knows it exists, if a tree falls in the forest and no one hears it, does it make a sound? No, it doesn't. So the other thing we have to talk about is, what do you do when the document is complete? You have to make copies. You have to give those copies to the agents. And then you have to give those copies to your physician and the hospital. And I encourage you at that point to have a conversation with your physician. Part of the reason the other part of the reason that I think these documents have become so important to complete is that physicians are very fluid. It used to be that, you know, the doctor your parents had is the doctor you had, is the doctor, you know, it's the same person throughout your life and really knows you. But that's not true so much anymore. There's a lot of fluidity when it comes to healthcare providers. So those conversations with your physician is important. And the other thing is, it's really important on your next doctor visit to say, can you find my power of attorney for healthcare in the chart? Because that's not always easy, and it reinforces the need for that. So I encourage everybody, after they've completed it and it's been filed, to make sure that it's in there by, you know, putting that poor med tech person on the spot and having them find it in the electronic record. So as we round the corner to the end of our conversation, I want to give you all just a little space for some final thoughts. And maybe I'm going to start with my final thought, which is how much I appreciate all of you being willing to share this experience you've been through. And I'm going to put Todd on the hook a little bit and say part of what I think is also really important is that we have a place to store these records throughout for the whole state, because you know, we travel, and in my ideal world we'd have one document for the nation and one place to store it for the nation, because it's about finding that document when you need it. So that's my next goal after we become lacrosse. So final thoughts. Let's start with you, Todd.
Okay, well, first of all, I'd like to thank you, Helen, for nagging all the people, a lot of the people on the panel to get this done. And I'm sure that there's a lot more than just on this panel. In preparation for this today, I did think about possible legislation or possibly some type of registry, and our office will be looking to see what some of the best practices are in other states. And certainly, we are in kind of a unique position in Wisconsin. We have Epic Systems in Madison, which is probably the biggest clearinghouse in terms of information in the United States. So certainly something to think about. You know, one of the things about legislation is you often have to think about unintended consequences, and we would just have to make sure that that somebody who had the actual written document would still be allowed for that document to be legal and binding if it was somehow not on the registry. But certainly something that I will look forward to digging into a little bit between now and the next legislative session. So thanks for having me on today.
Thank you. Joe.
It's really easy. There's no reason to put it off. Just do it. It'll force some conversations that you probably otherwise wouldn't have with your partner or your family or whoever you make your agent, and just get it done.
And those conversations are, you know, I'm going to stop short of fun, but they're good. They're good conversations.
I made a note of that because you had one of these questions here about whether, dare you say it, was fun. And I don't know that I'd call it fun, but I wouldn't call it grueling either.
Right, yeah. Steve, how about you?
I'm with Joe and Amy in that it's important. I'm more of a blunt instrument when I talk to people about it and say, just get it. Yeah, you got to get it done. It's not something you can put off because anything can happen, especially from what I've seen. Tomorrow could be your last. So you just got to get it done.
And Veronica.
Yeah, I agree. I think most people are scared to do it because it looks like a big packet at first, but like when I actually did it with you, Helen, it was like really fast and easy, and then got it signed right away. So it's just a lot of reading, and I think people get nervous with that. So
Yeah, we do need to look at how we present information. And Amy.
Yeah, I mean, just reiterating what everyone says. It's quick, it's easy, it's important. May not be the most fun activity during your week, but it'll definitely be one that'll probably give you the most peace of mind that you could complete. So doing it there is important to do.
Well, thank you all so much. I know our team has been monitoring chat, so I didn't know if there were any questions that came up that we wanted to address in our last couple of minutes. Rachel, have you seen anything in there?
We've been addressing them as they've been coming up, Barb and I.
Okay, very good. Well, please, everybody, put your hands together for this wonderful panel from our community. Aren't we blessed to have these folks among us, you know? And thank you all for attending. Those of you who already have your power of attorney for healthcare, you know to pull it out and take a look at it. Those of you who need to complete one, we're going to put a slide up at this point, and it will give you a bunch of information on who's here to help you, which includes the Aging and Disability Resource Center, Frederick South, Hospice Alliance, and Advocate Aurora. All of us are lined up and ready to be of service in this important mission. So thank you all.
Thank you. Nice to meet you all.
Nice to meet you, Steve. Take good care. And Todd, I'm so sorry we didn't get a chance to see you, but your voice is just all we ever need.
Well, it was great being here.
Thanks.
Thanks, everyone.